Narayana Health is taking this initiative to throw light on two subjects today. One, the role of AI in digestive care, gastroenterology. And the second, the importance of organ donation. How, as a society, we can raise awareness so that this does not become a one-off case, it becomes a regular practice. On stage today, starting from my right, we've got Dr. Rahul Roy, GI and liver transplant surgeon, Dr. Sandip Pal, gastroenterologist, Dr. Bohidar, also gastroenterologist, and Dr. Abhijit, CP, director, Rabindranath Tagore Hospital. Without wasting much more time, I would request Dr. Sandip Pal to take the proceedings further. Sir.
So today we have gathered here for this press conference. So we shall discuss three topics here. So the first is AI, then the application of AI in gastroenterology. Next, Dr. Rahul Roy will speak on liver transplantation. He will speak on the disease donor liver transplantation, and Bohidar sir will speak on live-related liver transplantation. And Mr. Abhijit will sum it up, and like what we have been doing in our hospital for so many years, he will sum it up. So let me start first with AI in gastroenterology. So you must be seeing now in WhatsApp also, when you open your WhatsApp, the AI has come. So everywhere, if you Google something, AI is there. So if you write something in the Google, if you want to search, first AI will give one result, then you can scroll down and you can see the other searches. So AI is becoming slowly, it is becoming indispensable in our day-to-day life, as well as the applications are coming in gastroenterology. Now, this is not new. This AI thing is going on for decades, say almost 1 or 2 decades it has been there. But since last 3-4 years, it has come rapidly. Like it is coming almost to the practice. So right now, the status of our state, like we are not doing AI, we are not doing this, applying this technology in our day-to-day practice. But yes, for research purpose and to do it on patients, we have done a few cases. So what I can tell you about this technology is artificial intelligence is all about computer learning. So first we have to feed the computer. So let me give you an example. Suppose, as you know, there is a large intestine, and in the large intestine there are polyps or tumors that happen. Or in the biliary tract, in the CBD, pittonali, jeta bole, okhane tumor hoy. So what happens now, how do you know when you do endoscopy, how do you know when you see the polyp whether it is a malignant polyp or it is a benign polyp, or if we are missing any polyp, because the colon is a long structure around 1.5 meter long and there are folds in the colon. So when you go with the scope, sometimes if there is a polyp behind the fold, we can miss it. And in standard textbooks, the miss rate of polyp is from 20 to 30% when we do first time colonoscopy. So what is done in this technology is we feed the machine with images. Like lot of millions of images are being fed to the machine. Like this is a malignant image, this is a benign image, and this is how a polyp looks. It is fed into the machine from our, like what we do procedures normally without AI, we have all record our procedures. All the pictures are recorded into our system. So these pictures we are feeding to the machine. So next time when we apply this software into the colon, the machine, the software tells us, like here there is a polyp. So it shows, a rectangle comes and it shows us that there is a polyp. So we can go back if we have missed that and we can detect. So it helps in improving the detection rate of polyps. And it is very, like it has come first in the Western countries because they are more predisposed to colonic cancer. But we are also not far behind. In India also, colon cancers are there. A lot of colon cancers are there. We see in our regular practice. So this technology is equally required for us also. Like like I have told you about colon, similarly about esophagus, the food pipe, then stomach cancers hoy. Cancers that are early gastric cancers. এবার এই ক্যান্সারগুলো যদি আমরা আর্লি গ্যাস্ট্রিক ক্যান্সার আর্লি স্টেজে যদি ইফ উই ক্যান ডায়াগনোজ, তাহলে উই ক্যান অ্যাভয়েড বিগ সার্জারিজ। সো হোয়াট উই ক্যান ডু ইজ উই ক্যান রিমুভ দ্য পলিপস এন্ডোস্কোপিক্যালি। এন্ডোস্কোপি দিয়ে পলিপটাকে রিমুভ করে দিয়ে যেতে পারে যদি ইফ উই থিঙ্ক দ্যাট দিস ইজ এ ক্যান্সার, দ্যাট দ্য মেশিন উইল টেল আস দ্যাট দিস পলিপ লুকস লাইক ক্যান্সারাস, সো উই ক্যান রিমুভ ইট। And at the same time, we can do during diagnostic endoscopy, we can remove the polyp also. So it saves time, it gives more accurate. So likewise in all organs, in the liver, in the CBD, in the stomach, in esophagus and colon, everywhere this application is being done. So in India now we have companies like Olympus who have come up and they have tied up with few other multinational companies, HCL, and they have opened up their offices in Hyderabad and all, as I know. And R&D is going on, research and development is going on, and in next 2-3 years it will be, I hope this technology will be readily available to us and we can apply this in our diagnosis and day-to-day practice. This was about application of AI. After this, if you have any questions, I will be happy to answer. Next, I will request Rahul to speak on.
Good afternoon, everyone. I'll speak about deceased donor transplant. So, who is a deceased donor? A deceased donor is a person whose heart and hence the circulation is intact. The blood supply to all organs are intact, but there is head injury, brain injury, and as a result of which the patient is in a comatose state, and for them a meaningful recovery is not possible. So in such cases, if their family members gives consent to donate the organs, those organs can be retrieved and can be transplanted into other patients who need a transplant for their healthy life. So from one diseased donor, 2 kidneys can be given, lung can be transplanted, heart can be transplanted, liver we can split into 2, and we can give one small part to a child and the bigger one to an adult, and also cornea can be donated. So with disease donation, one person can save 6 to 7 lives. It's very low, particularly in the eastern region of the country, and as a result of which a lot of people are dying every day waiting for a transplant to happen. So I would patient, as we have done 28 transplants in our hospital in last 5 years, and only 3 have been diseased on the liver transplantation. All of the 3 patients are doing well, and when they come for the follow-up, they are very thankful to the person who has donated the organ. They sometimes ask us, can they meet them, but due to privacy concern, we cannot do that. But they are forever grateful for this gift of life to them. So I would request everyone to take the pledge of organ donation. Thank you.
And liver transplantation. We want to make some awareness amongst the general population, and what we have done today, tomorrow and day after tomorrow, is that the doctors who will be practicing gastroenterology, or they will be giving gastroenterological service to the people, if they are educated enough about these 2 things, then our job will be better done. Rather than talking to the lay people, we may not be able to cover too many people. So we will be talking to the select physicians tomorrow and day after tomorrow, and we'll make them more aware about these topics, so that they will in turn help us in making the public aware. Now regarding this live donation, as already my colleague said, that out of about 30 transplant, we have only 2 deceased donor. That means donor, dead person have donating the organ. Most of our people, our public, they are very fond of their relatives. There are the relations, like a husband is more conscious about his wife. So unlike in Western countries, we have more of live donation. How I will give one liver? No, we are not taking the whole liver. We are taking only a part of it. About 50% of the liver is taken, and the same organ again. So the person who is donating, maybe after a month or so, he will be able to work around his normal activity. He can resume, and in roughly 1 year's time, the liver will also be complete. So that's very important. People are shy of giving, or they're apprehensive of donating a part of liver. So it should be clearly passed on to the general public. And the medications that etc. are needed are very minimum, and the person who is receiving it, the chances of having a successful transplant is much more in this live donation. With this, I'm concluding.
Nicely elaborated on what this conference is about and what we are planning to do over the next 2 days. Like Dr. Sandip pointed out, in the last 3 to 4 years, the advancement of AI in healthcare has been very rapid. Areas like radiology and imaging, neurointervention, and the initial results have been fantastic. It improves accuracy, it improves throughput, it's way faster than what humans can do. So this adoption, we have to increase awareness and we have to ensure that we adopt it with enough safety protocols. Spread this awareness. If there are any questions, we can take them now. Thank you.
ডক্টর বৈদার সেটা হচ্ছে লিভার ট্রান্সপ্লান্টে কতক্ষণের সময় অপারেশনটা হয় আর এটার খরচ কত?
খরচটা তো is a commercial angle, so I will not be able to tell you right now. That we can discuss later on. And time, it all depends. It is roughly ranging from 10 hours to 12 hours. So that is the time it takes.
আচ্ছা, আরেকটা জিনিস হচ্ছে যে আমরা এর আগে
This applies to deceased donor. And ওখানে about 500 kilometer or 1000 kilometer away somebody has died, the kidney is working or liver is working, the organ is harvested there and is transported. So that is a green corridor. But usually a live donation is done in the same place because we want to take advantage of the time. After taking out the organ, it should not be for a long time. It is ischemic time we say. So that period should not be for a long time. So we always, mostly, live donation is not done in that way that somebody donates it on daily and the organ comes here. Usually that is not done.
আচ্ছা, কী ক্ষেত্রে অ্যাকচুয়ালি মানে ট্রান্সপ্লান্টটা করার মতো পরিস্থিতি কী করে আমরা বুঝতে পারি যে কোন সময় তা করতে হতে পারে?
ও সেইটা আপনার ট্রিটিং ডক্টর ইউজুয়ালি বলবে। একে আমরা বলি এন্ড স্টেজ লিভার ডিজিজ, মানে ডিজিজ যেখানে আর মেডিসিনের মাধ্যমে আর কিছু হয় না, ইউজুয়ালি সিরোসিস, মানে লেমেন জানার জন্য পা জল জমে যাবে, পেটের জল জমে, জল উদরি যেটাকে বলি, আর মুখ থেকে রক্ত পড়বে, এইসব জিনিসগুলো হবে। ট্রিটিং ডক্টর বলবে যে লিভার প্রবলেম আছে, সিরোসিস অফ লিভার ইজ দ্য মোস্ট কমন।
এই সমস্যাতে না পড়ি তার জন্য আমাদের কী করা উচিত?
তার জন্য এর মেন রিজন হচ্ছে সিরোসিস হওয়ার, এক হচ্ছে অ্যালকোহল, দুই হেপাটাইটিস বি অ্যান্ড সি, হেপাটাইটিস ভাইরাস, অ্যান্ড এখন একটা সবচেয়ে বড় হয়ে আছে যে মোটা হয়ে যাচ্ছে মানুষ, ফ্যাটি লিভার হচ্ছে। ফ্যাটি লিভার সেটা মোস্টলি সিরোসিস হয়ে যায়, সেইখানে প্রবলেম হবে। তো স্বাস্থ্যবান খাদ্য খেতে হবে, এক্সারসাইজ করতে হবে, এই জিনিসগুলো জানা কথা।
নমস্কার।